I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. And I am so glad to get to chat with you all about this very difficult case. And welcome to everybody. We have at least one person that has not heard about this case at all. So I will do a very brief overview of this case. This case is Meggan Sundwall. It was a registered nurse, and she had a friend that had been a roommate, and that friend's name, a female named Terry. Sorry, not Terry. Her last name is Terry. It's Casey Terry. What is the victim in this case? And Casey had some issues. So Casey faked terminal cancer for 10 years. So for over 10 years, Casey told her family, she told her friends, she told everybody that she had cancer. But the person that she talked with the most about her medical, based on text messages, was Meggan. And Meggan, once again, was a nurse. And when Casey would talk to Meggan about all of her painful suffering and everything, Meggan would kind of be like, stop holding on, like just go on ahead and be with God. There's nothing for you here. Like just go and be with God. Casey lied to Meggan and told Meggan that when she died, Meggan would inherit over $1 million in a life insurance policy. How much life insurance did Casey have when she died? $0. Casey did not have a life insurance policy when she passed. And this is a very difficult case because the victim, it's you have to decide, did the victim do this to herself? Did Meggan do this to her? Or did Casey do something to herself and then Meggan just sat and watched? So on the day that Casey died, Meggan came over around 10 a.m. and Casey has a glucose monitor, so for blood sugar. So there are a bunch of type 1 diabetics that live in Casey's home, and she has access to insulin and she has access to glucose monitors. And her and Meggan have been talking about using insulin for months now. And Casey is telling her, like, I'm trying to use the insulin, but it's just not working. I have to have a surgery on my body because my body is like not metabolizing the medication to a point where I can die. Casey made up fake hospice nurses and a fake hospice doctor that she would text Meggan, but it was actually Casey. So Casey would text Meggan as though she was a hospice nurse or a hospice doctor. Okay. So on the day that, because Casey, she didn't die immediately, but on the day of the major incident, which was August 12th of 2024, I want to say it was 2024. I'm almost positive. it was 2024. Yes. On August 12th, Meggan comes over and then she continues. So somehow Casey's blood sugar continues to be tracked all the way until the point where it is medically impossible for Casey to be tracking the blood sugar at some point. And Meggan searches on her phone, how low does the glucose monitor, like what's the lowest reading on the glucose monitor? Because the glucose monitor, once it gets to below, I think 19, I think it was, when the blood sugar is being measured under 19 or less, it does not register it at all. I want to add a little bit more complexity to this. So Casey told her sister Kylie that Meggan was trying to kill her with insulin months before. So Casey and Meggan used to live together, and right before, so Meggan and her family go out of town, and while they're out of town, Casey reaches out to her sister and says, come and get me. Meggan's trying to kill me with insulin. So an issue of splitting comes up, and we are going to break that down a little bit more. But this case, I don't know what the jury is going to do with this case. I do think there is evidence in the text messages because Meggan sent Casey a text message on August 12th saying, "Do you want me to give you something so you can go to sleep? And I can," so she doesn't say, "And I can give you the insulin," but like it's kind of alluded that she would do something while Casey was asleep. Like that's kind of what it alludes to. Um and I think the fact that Meggan thought there was an insurance policy, because the way that Meggan handled Casey's cancer is not the same way that she handled her dad having cancer. So Meggan's dad had cancer, and she encouraged him to get treatment to see what they could do. Casey, is saying she has this terminal cancer, and um Meggan is kind of encouraging her to just, okay, go on ahead and die. And it's my understanding that Casey was alluding to the fact that she might do something to herself, but she never did. And so I'm going to get into it a little bit later because I want to talk about some other key witnesses from this past week. This is my third video on this case. So if you would like to hear more about when Casey's family, so Casey's sister and her uncle testified. Casey's mother died when she was around 3 years old, and her father died in 2011. And she lived with her uncle and her grandparents. To make this even more complex, Casey was also stealing money from her grandparents. We're talking about to the tune of over $60,000. So the defense is trying to say that the family was about to find out that Casey was stealing money, and this is why Casey like did this to herself. That is what the defense is trying to say. The state is trying to say Casey was all talk. She would never do this to herself. And sometimes Casey would lie and tell Meggan, "Oh, I gave myself the insulin. My blood sugar is whatever, or my heart rate is some ridiculously low level that would mean you were dead." And so that's where the state is like, why didn't Meggan see that she wasn't telling the truth? So for this past week, let's start with the messages. So in my last video number 2, we talked a little bit about some of the testimony. I want to say it was from Monday. I did a video on Tuesday talking about testimony. It was testimony from earlier on Tuesday because they didn't have court on this past Monday. But I didn't get to the messages where Casey asked Meggan to reassure her that she wasn't dying. And Meggan responds with, "Unfortunately, I don't know if you're dying or not. I'm sorry. You need to be prepared no matter what happens." Okay. In June 2020, Casey sends a message saying that she's in a lot of pain and doesn't know if she can handle it. And Meggan responds with, "I'm sure it is only going to get worse, unfortunately." The process of dying is pretty brutal from what I've observed. I made notes of certain messages that really stood out to me in the messages going back, but between Casey and Meggan. Casey sent a message, "I can't do this. I'm scared. I, um, I'm scared to live and I'm scared to die. I can't even breathe." This was August of 2020. Meggan responds with, "Casey girl, what choice do you have?" Meggan says, "I really think you need to replace your fear of death with more faith." And they are Mormon, but the way that Casey talked about faith, because Casey was also abusing substances. So Casey was selling her oxy to get Xanax. So like this whole thing is just what? Like this whole case is just so wild. So wild. I'm going to go through more of my notes. Please hold any questions you have because I can't monitor chat while I'm kind of going through this. Oh my gosh. All right. So later in August, August of, I want to say, I forget the year, but Casey sends a message to Meggan. So Casey sends a message to Meggan. Uh, oh, so I think, so Casey sends this like really long, this message. And then Meggan, once she sees it, says, "Sorry, I just got these. I've been up all night with." So Meggan has a son, and she says her son's name. "You didn't freak me out, Casey. You're never going to pass away if you keep freaking yourself out and going into a panic when you start to feel bad. I'm convinced you are not going to pass until you actually want to completely. You've asked for blessings, taken stuff, and say you want to, but you know you don't. You have to let go. It's past time. There's nothing left for you here. Everybody is um everything in life, so everything is ahead of you in the next life." That was the gist. I think my notes got a little bad with that. I was taking notes as I'm listening and probably doing 5 other things. "Move forward and stop only existing." That's not a very supportive message to somebody that says that they're doing like this. That was not a very great one. So where did the media narrative come from that Meggan convinced Casey? Yeah, so I haven't heard that anywhere often. So I haven't heard it anywhere because it's I believe Casey did that on her own. So Casey did truly only have one liver. I'm sorry, one kidney. So Casey had one kidney and she had a port and she had all of these medical supplies. And I think Casey wanted to be the victim. In some of my past videos, I've talked about factitious disorder, people that use medical, somatic, physical complaints to get attention, support, to get different needs met. And she might have met criteria for a diagnosis like that, but she didn't lie to everybody because so Casey knew she didn't actually have cancer because she had a knee replacement surgery about 3 weeks before she died. So the thing I can't get over is why would somebody have knee replacement surgery and then and she had plans to have another knee replacement surgery, but she had been telling Meggan that she was going to do this, that she was going to do this, that she was going to do this. And Meggan kept saying, "If you want me to be there, I'll be there with you. Like if you want somebody to be there." And that's where, if Casey wanted to back out of it, I don't know if Meggan would have I don't know, like I have questions. I have questions about what Casey really wanted because Casey would lie and say that she had taken insulin when she likely hadn't and that she was trying to end her life, but it seemed like she just wanted Meggan's attention. Excuse me. All right. So just general thoughts. We don't know for sure. And so um And so the messages back and forth were a lot. And the defense brings up the fact that the ones that the state picked, so the state handpicked some messages. The defense, countered with some messages. Um, the state brought up the fact that Meggan never referred Casey for any mental health help, never encouraged her to look for joy or to live her life, never told her that her life was worth living. Casey even asked her how she got $1 million policy with all the health conditions that she had, and Casey lied and said that she bought it back in 2011, which wasn't true. Casey said that the cancer had spread to her breast tissue, which was not true. And Meggan kept telling Casey about her financial problems. And Casey would say, "I wish I had money for you. I wish I could just pass away and give the money to you." And Casey, to me, was always very supportive of Meggan. And in one of the messages, Meggan said that she didn't believe that Casey was actually thinking about hurting herself. She said, "I don't," so this is what Meggan said, "I don't think you want to off yourself. And I completely understand that." So that was, I guess that could be, I don't know. That's a neutral message. I don't know. Cause I think that came after Casey saying, like, "If I could just die, like that would help you financially." Casey did send messages like that. All right. In February of 2024, I believe, Casey said that she figured out a way to get some insulin, and then she told Meggan that there was like an envelope that had her name on it, that had all the like information for the insurance policy, but that wasn't true. And then June 3rd of 2024, Meggan offered to come and give her insulin regularly to see if it worked. So once again, in June, Meggan offered to come and give her insulin regularly to see if it worked. And that seems like a crime. I could be wrong. Remember, I'm not a lawyer. I am not a lawyer, but it seems like Meggan could have been the person that administered everything. I don't think Casey would have done it herself. I don't think she would have. And we have a graph of her blood sugar levels. So let me pull that up. Hopefully this doesn't do anything weird. Good. All right. So let me share my screen and we can look at a graph of Casey's blood sugar level. All right. So depending on the person, above 80, sometimes above 70 can be considered normal. I am not a medical doctor. They did have an endocrinologist that developed this graph and talked about it. And remember, Meggan is a nurse. And I wonder if the state would have charged her if she wasn't a nurse. Like, I wonder if they're like, if that made it stronger, thinking a nurse should have known that their friend needed medical help. And because time and time again, Meggan would say that Casey had a DNR, but DNR, a do not resuscitate, does not mean do not provide care. Because what Casey needed was insulin. I'm sorry, glucose. She needed sugar. She desperately needed sugar. And so her blood sugar is normal. And so Meggan, y'all know me and names. Meggan arrives around 10 a.m. And then there's a little drop. And the endocrinologist said that drop could have been normal, like she's not sure. But this big drop around after 1 o'clock. So the drop between 1 and 2 o'clock. And during that time, so the drop from 1 to 2 o'clock, Meggan texts her mother to say that Casey fell asleep and she can't wake her up. And Meggan canceled, like, I don't know, because they're supposed to get together for dinner. And so what happened for that drop to happen? And the defense rested and the state rested. The state did not provide any rebuttal witnesses. The defense provided a forensic psychologist that I'm going to get to in just a minute. But that huge drop, something happened. And the defense is going to say that Casey did that to herself. But where I'm stuck is, so after 2 o'clock, it is impossible for Casey to be checking her blood sugar herself. In my just personal, and I think the medical people agreed. So people can have difficulty completing tasks with a blood sugar under 45. Things become blurry, like you're falling into, she called it hypoglycemia, but it's getting severe. And I didn't realize how much the brain needs sugar, and that the brain doesn't store sugar. So when the blood sugar is dropping like this, the first thing that you notice is sometimes some of the cognitive symptoms, because there are other parts of the body that can continue to function, but the part of the body that tells you to breathe and swallow, that part of the body starts to be brain death if it lasts for too long. And it's just, that's hard to look away from. That's really hard. That's really hard. There are allegations that Meggan did believe that Casey truly had cancer. the testimony from Casey's ex-husband, and they had been married multiple times. He thought it was 3 times, but he could only find proof of 2 times. He didn't remember any of the dates. One of the times they broke up was because he took his son on a vacation on their anniversary, like on his and Casey's anniversary, and she probably got mad about that. Um, uh, and yeah, he was an interesting witness. If you watch JD Explains, he is a lawyer here on YouTube. He breaks down different legal commentary. I've really liked his detailed coverage of that case. So Casey did not have diabetes. So I want to say that again. Casey did not have diabetes, but she had access to long-acting and short-acting insulin. Thank you for gifting a membership. Congrats to whoever received that. All right. Oh, let's get back to the notes. The defense brought up splitting, that Casey would tell different people different things and would deceive. So the defense said would deceive them to keep the people from talking to each other. And that was clear because Casey was telling Meggan that her family was horrible. They were so mean to her and they were evil, not evil, but like she was saying horrific things about her family to Meggan. And then to her sister, she's telling her sister that Megan's trying to kill her. And so that ensures that Kylie and Meggan never communicate. Because if they actually talked and compared notes, they would realize that Casey was manipulating them both. And just because someone's manipulative doesn't mean that they should die. So she told her family. She did not tell medical doctors that she had cancer. So any medical doctor she had, she never mentioned cancer, but it was family and friends. So her family that she lived with and her friends thought she had been battling terminal cancer, leukemia. So she did have a port, but it was for her kidneys. It wasn't for anything. And she did have a lot of medical appointments and things, but it wasn't anything about cancer. The medical, based on her autopsy, outside of only having one kidney, she was medically healthy. And the family, I think, was a little surprised to hear that because they believed she had terminal cancer. That's what they thought. But it was all a lie. And just because somebody lies doesn't mean like this whole situation needed boundaries. So I've talked about that on some of my prior videos. I wish Meggan had set some boundaries with Casey. Their relationship sounds codependent and really unhealthy. Like their relationship sounds super duper toxic. It was not good at all, in my opinion. All right. So a forensic examiner for the FBI talked, and I think he talked about that the insulin vial that somebody poked into it, I think 13 times, because he was looking at how many pokes was in a capped insulin vial. And Meggan's fingerprints were not found anywhere on any of her fingerprints were not found on what was administered, like the syringe, because it wasn't an insulin syringe. It's my understanding insulin syringes are really small. This was like a bigger syringe, and the endocrinologist believed that it was injected into her, like it wasn't injected the way that you inject insulin, which could also make you think, well, a medical professional would know how to inject it directly into the bloodstream. Based on how the blood sugar fell, the endocrinologist thought that it was injected via the skin and not through a vein. So, yeah. So factitious disorder is Munchausen. So Munchausen by proxy is when you do it to somebody else. So I don't believe that, so that would only be if Meggan had convinced her that she had cancer, but that's not true. And if Meggan was trying to get attention Munchausen by proxy is when you're making somebody else sick. Munchausen or factitious disorder. So the DSM-5 renamed it because in prior DSMs, I want to say it was Munchausen's in DSM-4. I could be wrong. I want to say it was. I could be wrong. But I know in DSM-5, it's factitious disorder. I have links to that diagnosis, and it might be here too, but I know I have it on my very first video. Yes. Yes, yes, yes. Um, is Munchausen by proxy also antisocial or clinical lying? So was it Gypsy Rose? I think I want to say it was Gypsy Rose. It's when you're making somebody else sick to get attention for yourself. And it is common for people with medical backgrounds to do something like that, normally to a young child. So the worst is when it's like an infant, like that's the absolute worst, because the person can where there's an adult making the child sick on purpose, but they're trying to get attention from the medical doctors and from the medical team, and so that's Munchausen by proxy. Munchausen is when the person does it to themselves. And so factitious disorder on another, something like that. Like there's a they renamed it with the factitious disorder. But yeah. You got to go back and watch. So I didn't watch every second of the medical, but I did watch the endocrinologist testimony was really, really interesting. Really, really interesting. I want to say Casey was 37 when she died. How old is Meggan Sundwall? She is currently 48. I believe she was 46 years old when all this happened. So Casey was 37, I want to say. I could be wrong, but I want to say she was 37 when she died. Yes, they're both adults. Very, very adult. Okay. All right. So let's see. I thought the endocrinologist who specializes in treating diabetes, she came in as an expert to talk about hypoglycemia, why it's dangerous, and she also talked about the death rattle, because people talked about how bad Casey's breathing sounded when she finally did get help. So for anybody that's new to this case, how 911 was called was so Meggan never called for help or the authorities. What happened because they were at they were at Casey's house. So they were at Casey's house. And Casey's uncle hadn't heard Casey all day, so he went downstairs to her room and hears her breathing, sees the stranger. He didn't know Meggan, and the stranger says she has a DNR. She doesn't want anybody to call for help. So the uncle calls Casey's sister because if anybody would know if she had a DNR, like he thought her sister should know. So when her sister hears that Meggan's there, Kylie, Casey's sister, says Meggan's trying to kill her. Like that's what. And then so Meggan and her family, they all leave. I forgot to mention that around 8 p.m. or so, Meggan's parents come and like they're praying with Casey. So Casey's passed out and breathing, having this really breathing. And they sit with her for like 45 minutes to an hour when the authorities are called. And Kylie, the sister, probably told Meggan to leave. She probably did. She probably said some things. I could imagine. But they leave before the authorities get there because the defense is trying to harp on how bad the investigation was, and the state is trying to talk about how like there were only until she died there were some things that they couldn't do. There were some because she had to give consent for some things to be searched. Like they didn't know that Meggan was going to say that Casey had gotten sick in the bathroom. They didn't know that they should search the bathroom, and so um I don't know. I don't know. Yeah, this is a really interesting trial. I think it was 7 days. It was only 7 days. You can skip through parts of it. The judge had them on a timeline. The judge was like, snap, snap. I want this to the jury by Monday. Hopefully we have a verdict by Tuesday. Like the judge has been on them to keep things moving quickly. But all right. So with this case, like I said, The endocrinologist thought that short-acting insulin may have been administered around 12 or 12:30, and um, and then she called it a profound insulin overdose. That's the only way that you see a drop like that happen, and that if Casey had received care immediately, that she could have been saved. But her insulin dropped to a dangerous level at 2 p.m. The paramedics didn't get there until 9 p.m. And Meggan was sitting there with her the entire time. It looks super suspicious. I don't know if it's a crime. It's gonna, so on Monday, they're gonna do jury instructions, and that's where the law is going to be explained to them. I could see the jury maybe, if the jury has options of lesser includeds, I could see the jury maybe saying like negligent I don't know. Like I could see the jury possibly finding something lower. I don't know if they're going to convict Meggan of like intentional homicide. I don't know if they will. So a forensic psychologist testified. I thought he did a really good job. And he testifies about 25% of the time for the defense, about 75% of the time for the prosecution. He used the police reports, thousands of pages of text messages, and he provided a consultation on the case. This forensic psychologist did not meet with Meggan. So he did not evaluate to like try to diagnose Meggan. That was a strategy by the defense because something could have come up in that evaluation that could have hurt their case, and then they would have decided not to include that. So he did not evaluate her. He instead looked at the behavior patterns in their messages and based on his understanding and knowledge of clinical psychology, what conclusions he could come to based on looking at that. I am glad he didn't try to diagnose anybody because you can't diagnose somebody that you've never met with. I also think the forensic psychologist talked about symptoms like borderline personality disorder in a very compassionate way. He never said borderline personality disorder. He talked about Casey's symptoms, her fear of rejection, her splitting, so like putting people against each other, her having either a very idealized version of a person or like, I hate you, don't talk to me kind of presentation. And all of the symptoms he was describing, to me, it sounded a lot like characteristics of borderline personality. He did not say it. And he also didn't call it like manipulation. He said like trying to get needs met. He talked about it in a very compassionate way, I thought. I thought some of the things he said could hurt the defense. And we will get to a little bit of that in just a moment. We're going to watch a little bit of his testimony, not all of it, just some. Let me know if y'all have any general questions along the way. I have a link to this full testimony down in the description. So he starts with his experience. I think he's been practicing since 2009, I want to say. And so I was licensed in 2010. I started doing clinical work under supervision in 2005. And so this is the forensic psychologist that was brought in by the defense. Okay, let's take a look at his testimony. We're going to do it at 1.25 speed. I'll slow it down if I need to. Okay.
And so the splitting, would be fair to say, is sort of like spokes, but no tire.
Yes, that's a common way we describe it. If I'm the one doing the splitting, I sit at the hub and I keep everyone their independent spoke away. Again, it's a coping strategy to avoid being hurt by rejection or by people discovering things about me that I find embarrassing or uncomfortable. On the outside, it obviously looks problematic, and it is problematic, but for the person experiencing the symptom, most people engage in this behavior as a way to cope with something they're experiencing that's very painful. Even though its behavior is problematic, that's what we call it a maladaptive coping strategy. It works rather well.
You said, and I get that. So the person in this case, we're talking about Casey Terry, is engaging in this to cope, but is hurting.
I would hypothesize that was her reason. I have to be cautious that I didn't interview Ms. Terry. So the patterns of behavior that she demonstrates are consistent with the patterns we observe in research or in people I've treated. I just want to be very fair.
Right, you're not, fair enough. On the pattern of, and on this feature of this coping strategy, can it be effective for people who are engaged in that behavior?
That's one of the problems with this behavior pattern is in the short term, it's really, really effective. It works rather well, and it facilitates the person having those needs met rather immediately. And it can last for a very long time. And that's why it gets used over time and across different relationships. And then another pattern we tend to see with individuals who demonstrate similar patterns is once discovered, they tend to terminate relationships rather quickly. They do a process we often call vilification or idealization. What this looks like is at one moment, this person's the best ever. I can't imagine living without this person. They're amazing. And the next, they're the worst person ever. I want nothing to do with that person. And so we rely very heavily or we pull away very quickly. And this is a similar maladaptive coping strategy that can play into the splitting behavior.
He does talk a lot, and I'm not going to play all of it here, but he talks about thoughts of self-harm, and then he also talks about para, so somebody that might engage in a risky behavior, but they don't actually want to not be here anymore. So he never once said borderline personality disorder, but the symptoms he was describing diagnostically, to me, a lot of them fit borderline features at least. So a lot of what he described and a lot of how people describe Casey, I wouldn't be surprised if she met criteria for at least some borderline features. She lost her mom really young. I don't know that she ever fully learned how to cope and grow emotionally. She got her needs met in very it was kind of problematic. Like, I think the way that she tried to get attention from Meggan was with her medical. Like, Meggan was the person that she said, I'm dying. Like, oh, woe is like and Meggan was just like, well, just die. Like, she wasn't feeding into it in a way that was like, oh, I feel so bad for you, or oh, I'm here for you. Like, or at least the messages that the state showed. Meggan would be kind of, I don't know, like, to me, it came off harsh to me. I don't, it came off a little interesting to me personally, but yeah. Um Thank you for the super chat. I appreciate it. And then I highlighted this question. Do you think Meggan had the power in the relationship? So I think Casey desperately wanted to be loved, and this forensic psychologist is going to describe Casey as a chameleon, that she was different with different people. And with some of her friends, she would talk about substances and she might curse, or she was one way with them. And then she was very spiritual with Meggan, and she might talk to somebody else different. Like, she was good at kind of reading people and giving people what she thought they wanted from her, which makes for a very fragile sense of self, and a fragile sense of self as like they don't know who they are. So I don't know if Casey knew what she wanted or if she felt safe enough or comfortable enough setting a boundary with people. So like Casey never told Meggan, I want to live. She didn't say, but she was also telling her, I'm dying of cancer. Like, this whole case is just, it's a lot. I'm going to keep this going.
You said it can go on for a long time. I mean, do these people ultimately have to also manage the notion that they'll be discovered?
There's always that. The research tells us that individuals who demonstrate these symptom patterns always describe that experience set.
Here.
However, most of the time, individuals with similar behavior patterns are so focused on the meeting of one's immediate needs, they have a tremendous amount of difficulty waiting and being patient and considering the long-term ramifications of their behaviors. So they get so focused metaphorically on what's here now in front of me that whatever might come later down the road, that will be dealt with at some point. It's not relevant nearly as much as what's happening now.
And over the course of sort of maintaining this coping strategy and the splitting, Does the research suggest that sometimes it needs to be energized or sort of increased to maintain the effectiveness?
Very frequently. Very frequently. It's similar. We talked about the moving from a parasuicidal to a quasi-suicidal, that in order to maintain the experience of the relationship and the closeness of the relationship pattern, individuals with these types of symptom patterns will often up the ante, so to speak. They amplify the intensity or frequency or the length of their behavior patterns, because one of the primary factors is reducing the risk of losing a person in their life. Individuals that demonstrate these symptom patterns are often highly sensitive to the experience of someone not supporting them or believing them or caring about them in the way that they desire to be cared or believed in or looked after. And so most of their efforts are geared toward reducing the risk of loss. And so in order to do that, they will often go to great lengths. In this specific case, one of the things I noticed was that in the communications between Ms. Terry and Ms. Sundwall, much of her communication descriptions were associated with adhering to religious tenets and following a faith system devoutly. With her conversations with other individuals, it would be engaged in behavior that would be inconsistent, at least with my understanding of those religious tenets, using substances, seeking out substances, language that would be coarse by its nature and not typically consistent, at least with my understanding of those same religious beliefs.
Mormon.
So as an example of using sort of one strategy with Ms. Terry, with Ms. Sundwall, and a very different strategy with individuals who are struggling with substance use behaviors. And that's very typical. Sometimes we call this being the social chameleon, where the individual modify their preferences, opinions, taste, ways of talking or dressing in order to increase their appeal to the person they're currently interacting with.
So that's where I thought some of that testimony could have hurt the defense. Because to me, I don't know that Casey really wanted to die. I think she wanted sympathy from her friend. I think she wanted her family to not like be on her case about getting a job or like maybe doing chores. I don't know that she actually wanted to not be here. But I think the way that she interacted with like I think if she might have thought if Meggan knew that she didn't have an insurance policy and that she didn't have cancer, Casey might have thought she might have lost that friendship. Because I wonder if Casey thought that Meggan was only there for that insurance policy, or like she was only her friend because of blah blah blah. Like so that's where I thought there were ways in which some of that testimony could have went against the defense too. It depends on how you listen to it. I wish they would show how Meggan started to encourage her to end things versus when she learned about her benefiting from the insurance policy. So it's my understanding the messages, because the messages they have go back to 2019 and it's over, I think like 28,000 text messages. It's a lot of text messages. And as early as 2020. So, the behavior, I'm not sure. So they are going to show that Meggan's financial situation, because at one point Meggan was married and had secondary income. So the jury is not going to know that Meggan lost her job. So it's my understanding Meggan was fired. I don't know if it was in July but around the time of the incident, Meggan was in dire financial straits because she was fired from her job for allegedly, I think, time card fraud or something. Like, it was something like that. She was let go from a job. And so I think the state in their closing, because closings will be on Monday, I'm interested to see if the state is going to put a timeline together. Oh, how I love a timeline. Like, give me a visual, help put the important messages where they need to go, and give me a visual. Please, state. I hope that there is something that pulls all of this together for the state side. And I think the defense is going to pull together the things that they believe supports the idea that Casey did this to herself. So that's what the jury is ultimately going to decide. As a nurse, shouldn't she have Baker acted anyone saying that they wanted to not be here anymore? So I don't know. So if I have a friend that's talking about like because a lot of times duty, what's it called? Some people talk about being a mandated reporter. So I'm a mandated reporter of child harm, uh, harm to elderly, or harm to vulnerable adults. If I'm on the bus and somebody starts talking about not wanting to be here, now, but that is not my patient. So you first have to decide, is there a duty of care? But that would be more of like an ethical board decision. I don't know if that's legal. So I don't know what the legal answer to that would be, but ethically, only like you have a duty to care for your patients. Um I'm bothered by the fact that she is a registered, or like I don't think, I think her nursing license is on hold. I don't think she's completely lost it yet. Um I have an issue with the fact that she sat with her as she was dying, and she was in pain. So, um, the details of the like, up until EMS gets there, because she likely needed suction. Um, and Casey had mentioned not wanting to, like, drown in her own fluid. Like, Casey had said she didn't want to die painfully, and this sounded painful to me. I don't know if it was. So for anybody that's new to this case, when EMS gets there around 9 p.m., they transport her to the hospital. They give her glucose inside sugar inside the ambulance, or at some point they give her sugar. And by the time she gets to the hospital, the first sugar reading they get is a 14. So after she received sugar, her blood sugar was still 14. And over 3 days, so from August 12th to August 15th, they were unable to stabilize her blood sugar. And they did believe that she had brain death, and she was removed from continued care. The family made the decision to do that, but that was what, and she was able to, because if she's in the hospital, they were likely able to make her as comfortable as possible. But she had already experienced, they didn't say it exactly this way, but my understanding, she had already experienced like brain death. There was no brain activity, and it's really hard to come back from a blood sugar that low over that extended period of time. Okay. So those are, yeah. So ethically and morally, I would think somebody should do something. So if I had a friend that called me and said they were going to do something, I wouldn't say like, "You want me to come help?" Like, I'm like, no. Like, I would, like, I would call their family. I would try to make sure that they got help and support. I've had friends that just had like, and I, as a person, I remember when a friend of mine looked at me and said, "Patrice, you need therapy." And I was struggling with a lot at the time. I wasn't having any serious thoughts. It wasn't like clinical depression or anything, but I was really struggling, and I needed to talk to somebody. And I was able to find a phenomenal therapist, and it went really great. That's not always everyone's experience. My first therapist was not the right fit. And it took years for me to try to find somebody again. Um, but I personally think Meggan could have done more. That's just what I personally think. Yeah, and that was, so the blood sugar was so low. Um, the reason why that graph, I'll show y'all the blood sugar graph again. The reason why it tapers off is because the machine can't read lower than 19. So the glucose monitor, it was just saying low, low, low. So the monitor could not go lower than that. The hospital was able to get a reading of a 14, and her blood sugar had been under 40 from 2 o'clock until, so 19, until, I guess the last reading was like between 7 and 8 o'clock. And around 8 o'clock, I think, is when Meggan's parents come over. And Meggan tells them that she's talked with the hospice doctor. So there's some lies here that, and you can't, but like Meggan tells her parents that Casey's hospice doctor, that she's been communicating with them and that he's aware of her current situation. But that's not true because Casey is her own hospice doctor. And to me, the messages where Casey is pretending to be a hospice nurse or a hospice doctor, her wording is exactly the same. Like they're reading those messages and I'm like, that's exactly how Casey texts. How are people not realizing that that's not Casey to me? But I'm somebody that looks into these things. I try to solve mysteries, not like for fun on TV, not in real life. And so, yeah. And the nurse practitioner had great reference with a patient at 24 and had her recover because of immediate treatment. Yes. Yes. 14. Wow. The first reading the hospital, and that was after glucose. So it was likely lower than 14. And so they believe she was giving long-acting and short-acting insulin. Because like I said, they were unable to stabilize her blood sugar. All right. So I will just continue to summarize what the psychologist talked about. His testimony was really good. He talked about the relationship between Casey and Meggan and that it was one of comfort, sharing time, sharing resources. And then he mentioned that individuals with high caring nurses often feel good about supporting others, and that sometimes there will be this confirmation bias where they ignore information that goes against what they already believe. Because a lot of people will be looking at Meggan like, how could you not know? But confirmation bias is real, and confirmation bias in medicine causes major problems. And in medicine, it can happen where a doctor is determined that like, oh, there's no way it could be this for this patient. And so they don't run certain tests. Like they're so fixed on their initial diagnosis that they don't consider other alternatives. And that can have that can end up in a person having less care. The psychologist also talked about a savior complex, that Meggan could have had this savior complex where a person might do something unethical, thinking that they're the only person that can save this person. I'm the only one that has the capacity to help them. I have to take you on because if I don't, I'm complicit in your harm. So he talked about that. And he also talked about blinders being on with confirmation bias as well. All right. And so he mentioned factitious disorder. He didn't go into it a lot, but he did mention it. And he talked about that a lot of Casey's communications was that of crisis, and that there was some emotional need being met, including receiving attention, but that her communications with others were very different. She did not. So Meggan was the only person that she did this exaggerated medical. Now, she did lie about the cancer to everybody, but this hyper focus on her medical, that was with Meggan. And he talked about that the only person that she talked about those thoughts of self-delete was with Meggan. She did not talk about that with anybody else. And he also mentioned that there could be a fear of rejection or abandonment, and that this could be a coping mechanism to get needs met. We heard him talk about splitting, and that it comes from a desire not to lose either relationship, and keeping them cut off can it ensures that they don't communicate and that the person in the middle isn't found out. He discussed a cry for help, and that that's often a way that a person seeks to get needs met when they're hurting. He mentioned that Casey was vulnerable and that it's common in individuals that are at risk of strong emotions. That's where, as he's saying all these things, I'm thinking he's checking my boxes for diagnosing potential like borderline personality features. Because he said that Casey was vulnerable, had really strong emotions, and that she was at risk of somebody taking advantage. Um, the defense pointed out the fact that Meggan never confronted Casey about the medical exaggerations, including low temperature, and that savior complex and unethical behavior would mean that Casey would remain in pain. Like if Meggan did nothing, in Meggan's mind, Casey would remain in pain. He has no opinion of whether it was redrum or self-inflicted. So he's like, that's up to the jury. Um, and the state showed him the message where Meggan, at 9:47 a.m., the day of the incident, Meggan asks, "Do you want to take some promethazine so you are asleep when I get there?" Patterns of quasi and para self-harm. Some people pretend to look like they're going to do something to themselves in order to get needs met. And then after that, there was a private investigator and there was no rebuttal. Welcome, welcome to the membership. Would you call Meggan? So it was toxic. It was super toxic. I wouldn't want a friend like that. There were no boundaries. It seemed codependent. They were relying on each other in an unhealthy way, in my opinion. I don't think their relationship was healthy. And I think Casey desperately needed boundaries. And individuals that have substance issues are at risk for becoming codependent and blaming other people on their problems. Now, here's a little sofa speculation. I personally think that Casey set Meggan up. And I wonder if the jury is going to think that too. But like, it could still be a crime. Because if Meggan did inject Casey, so I think Casey set Meggan up. My personal thoughts, I don't know that for sure. It seems that way. Because her telling her sister that like Meggan's trying to unalive me with insulin, but there are messages of like, it looks like Casey's on board with that. But like I'm so confused. And then this happens, but I don't know for sure if this is what Casey really wanted, because I don't know if Casey knew what she really wanted. I think she was in a vulnerable state. I don't know that she was in a state to make those types of decisions. I don't know. This is the most confusing case I have seen in a very, very long time. Very, very long time. Why would she do that though? Why would you lie about cancer for 10 years? I don't know that we can look at this in like a logical way. None of this is logical. All of this feels very, very messy. Super duper messy. Because so Meggan has a child. But maybe so Casey told Meggan she was deleting the messages about the insulin. But she didn't. She didn't delete any of her messages. Meggan deleted messages on her phone. So they compared Meggan's cell phone extraction to Casey's cell phone extraction. And there were messages on Casey's phone that weren't on Meggan's phone. And Casey told her that she was deleting messages, but she didn't delete them. And so it's like, ooh. The uncle called the ambulance. So around 9 p.m., the uncle comes down. He realizes there's an issue. Meggan says she has a DNR, and he does not know Meggan. He has never met her before, and Meggan is in his house. They're in his house, and Casey's breathing doesn't sound right, and so he calls Kylie, the sister, and Kylie says Meggan's trying to kill her, and he called authorities, and Meggan and her parents left before everybody got there. So, ah, so you're on this boat, and that's so I didn't talk about I did talk about the fact Casey's ex-husband did not believe that she had cancer. So Casey's ex-husband knew. Casey lies. Casey lies. So she had told him that she had cancer. He did not believe her. He didn't believe her. But I don't know that he told that to anybody else. I don't know how connected he was to anybody else. I feel like his name was Casey too. Was his name Casey too? It seemed the names sounded weird, and they got married a lot. Yeah. Like, because like, why would you tell her that she would inherit money if something happened to you? But like, was that like a test of like, do you really love me as a friend, or do you want money? Do not test people like that. Do not do that type of test. I'm behind on testimony. Has her ex-husband testified? Yes. I believe that was, don't get me lying. It was Thursday or Friday. Let me look at this. I think it wasn't Friday. It might have been Thursday. I'm not sure. So JD Explains covered the husband's covered pieces of the husband's testimony. So he felt like the ex-husband really, really loved her. He probably would have married her again. Like, it seems like they were on again, off again. I think he couldn't provide the consistency that she wanted. It was hilarious because he talks about they broke up the first time because he told her to get a boyfriend, because I think he was going to go work on an oil rig, or I don't know, like he was going to go do some job where he wasn't going to be around enough, and she needed attention. And so he was like, go and get a boyfriend. Now he says he wasn't serious, but maybe I don't. He was a funny guy. His test, if you didn't see it, the ex-husband's testimony was pretty interesting. Yes. So that's where I wondered. So Casey Googled what happens if you inject yourself with saline. So Casey Googled that. So I think Casey wanted to make it look like she was injecting herself with insulin, but wanted to inject herself with saline. This is all sofa speculation. I don't know this for sure. Okay. I don't know that, but Casey Googled that. And then Meggan's Googling, how low does this glucose monitor go? And there could be a spiritual side to this. I don't know if anyone on the jury will be Mormon. This case does come out of Utah. Because some of Meggan's comments, it made it seem like she wanted Casey to be with God, but she also wanted the money, I think, too. It was weird. This whole thing is weird. It really is weird. We did 2 cases today. I did just want to briefly mention, I'm not going to go into the details of this, but I am following it. And if there's any major hearings, or when this case does go to trial, if it's a publicized trial, I will definitely cover it. So Joseph Duggar was arrested for a past incident in Florida. He also has charges pending. I want to say it's in Arkansas. His wife was also arrested, but she was released related to something that happened in Arkansas. We do not have the details. He may get a plea deal. So I don't know what's going to happen with the case in Florida. There is a potential that he might plead guilty to those charges, but I think the charges from Florida are pretty significant, and he's facing significant time. I've sometimes seen, and I hope the prosecutor doesn't do this, but I've sometimes seen the prosecutor, if the person pleads guilty, sometimes they plead them to like something lower that has less time. I don't know what's going to happen in that case, but it's definitely something that I'm following. Ooh, the whole Mormon wives, Bachelorette. I might have to do a video about that one on Tuesday. I'll probably be doing this. I might do 2 videos on Tuesday. We'll see. I definitely want to talk about the Bachelorette season getting canceled, and the video. If you don't have the video is a lot. I did watch it, and um, mm, I did not watch Secret Lives of Mormon Wives. I heard updates on the last season leading into The Bachelorette, and then that video dropped, and then all of that drama happened. And so there might be something, because I want to talk about toxic relationships. Because, in my personal opinion, I do not know them personally, but I've seen their relationship on social media. It's bad. The relationship between Dakota and, y'all know I'm bad with names, and the girl, but their relationship is bad in my opinion. It's bad. It's bad. And so I will be keeping an eye on that too. And then lastly, there is a case out of Hawaii, and I think the husband is going to testify. So it's like the hike trial, and somebody asked me to cover it. I didn't realize that the husband is likely going to testify. So I think the wife is going to testify, and the husband is claiming self-defense, but witnesses got there, and like, I don't know. So I am following that case. I think that his testimony might be coming because the state is going to finish up their case, and then the defense has said that at least in their opening, that he wants to tell his side. And so we will see what happens. I normally cover when defendants do testify, because the jury has to decide who they find to be more credible. And I also want to see what happens to him on cross-examination, because it sounds like he bought the trip, he planned the excursions, all of those things, and then he tries to like push his wife off a cliff. And like that's all super duper. And he's alleging that she had an affair, but like that doesn't get a divorce. If you don't like your spouse, get a divorce. Do not try to push them off a cliff. And so I'm definitely keeping an eye on that one. Welcome, welcome. And we did oh gosh, I woke up at like 6:45 this morning, and we were outside from 7 a.m. until like 12:15 p.m. doing a garage sale this morning. My kiddo's super excited. He made $100, and now he wants to go buy a cactus. It's not going to be $100. It's probably going to be like a $10, $15 cactus. But the kiddo wants to buy a cactus and a sand terrarium. So desert terrarium, I think. And so, but I told him I will search for that next week. I have no more things to do today. So we have that case. There are a few other cases that I'm following. I'm definitely going to cover Courtney Clenny whenever she goes to trial. And then there are some other things that I'm keeping an eye on. There was a question that I starred that I wanted to come back to. Was Casey testing her due to her own psychological issues? So I don't know. I don't know what Casey was doing, but I think she wanted attention. I think she wanted love and support. And I think she wanted her friend to be on her side. But the way she got attention from that friend was by like amplifying non-existent sicknesses and talking about wanting to die and how she was trying, but it wasn't effective. So Casey lied and said that her doctors had a surgery plan for her to help her metabolize medication better so that she could die. Like she could but like, no, like that wouldn't happen. So the whole thing is just very, very odd. Super duper odd. But yes. Barry Morphew. Wait a minute. The name sounds familiar. Y'all know me in names. I feel like yeah. Did he testify? I know that trial is happening. I don't have y'all. I only have bandwidth for so much. Oh yes. So the wife survived. I apologize. So the wife, hopefully ex, I hope they got divorced. But the case out of Hawaii, they were there on vacation. Like they were where they were on vacation. And So some passersby, including one person was an ICU nurse, she heard help, help. She heard screaming, and they went up and they saw him with a rock in his hand. Um, they saw him hit her with a rock like once or twice or something. Like he was on top of her with a rock. And so that's what the eyewitnesses saw. And he's trying to claim self-defense. But I don't like self-defense from what I'm so confused. But he's gonna try to explain it. He's gonna try to say she tried to attack him and he was protected. I don't believe a word. I don't believe a word of it. I don't believe a word of it. I don't know. I could be wrong. Yes. Hey, mama. She helped me outside with the garage sale. She came up and helped with the garage sale today. Let's see. All right. So, yes, Courtney Clenny, another toxic relationship. And I think she's going to claim self-defense as well. And I think there's clear evidence of her being the aggressor, similar to that woman that was supposed to be the bachelorette, where like, because alcohol involved in both of those videos. And the video that was released was from 2023. And supposedly ABC, everybody was aware of it. They were aware that she allegedly like was with Dakota multiple times before leaving for the bachelorette. Like, I don't know. She kind of didn't want to go at one point, according to the Secret Wives of Mormon Lives. I don't know. The whole thing is weird. But we'll talk about that next week. All right. I hope you all have a great rest of your day. Be kind, don't do crimes, and I will see you all next time. Have a good one. Bye.